Hello guys, welcome to Prakash Med. Today we are going to discuss about filariasis. First we move on to the introduction part. Uh, First we talk about nematodes. Nematodes are roundworms in which uh, tissue nematodes are the type. Tissue nematodes include Eukaryaria bancrofti, Brugia malai, Loa loa, Tracunculus medinensis, and etc. Definitive host. A definitive host will be humans and intermediate host. Intermediate host are mosquitoes. Main principal vector is a female Culex mosquito, and other uh, rarely involved are Anopheles mosquito, and Aedes mosquito. Aedes transmits subperiodic Eukaryaria bancrofti. Subperiodic means uh, microfilaria will be seen in peripheral blood in daytime and nighttime. Microfilaria will be seen in peripheral blood in daytime and nighttime. In day and nighttime. And Culex mosquito transmit only nocturnal, periodic Eukaryaria bancrofti. Periodic means we can see macrophilial larvae in peripheral blood only at the night time. This exhibit nocturnal periodicity. Then we move on to the life cycle. When infected mosquito bites man, it transmits infective form L3 filariform larva into the skin. And these L3 filariform larva migrate to the local lymph nodes where they develop into adult worms. And this adult worm undergoes fertilization, and male worms dies male worms days after fertilization or mating, and a female gravid worm gives rise to more than 50,000 microfilaria per day, and microfilaria are the uh, infective form to the mosquitoes. A life cycle of microfilaria will be 1 year, and uh, within 1 year, if a mosquito bites infected person, it transmits to the mosquito. Microfilaria are ingested by the mosquito. It transmits to the mosquito, and where it undergoes twice molding and becomes L3 falciform larva, which is infective form to the man. Lifespan of microfilaria will be 1 year. Microfilaria is 1 year. If within 1 year mosquito bites infected human, this microfilaria or the infective form to the mosquito is transferred to the mosquito. And then we move on to the clinical features. In this, first is asymptomatic microfilaria. It means mainly endemic people, mainly endemic people will be infected with uh, this filaria infection, but they won't show any symptoms, any clinical features or symptoms. But we can see, but we can identify microfilaria in their peripheral bloods. In their peripheral blood, and they also show some uh, when we examine these people, we can also find some features like microscopic hematuria, microscopic hematuria or proteinuria, and filarial dance sign. Filarial dance sign means uh, motile worms, motile worms will be identified, in scrotal lymphatics, scrotal lymphatics. And then we move on to the acute adenolymphangitis. Uh, when people infected with filariasis, they show a fever called filarial fever. First sign is filarial fever, filarial fever, and they also show some lymphangitis. Lymphangitis means there will be inflammation of lymphangitis means uh, inflammation of lymph vessels, and lymphadenitis means inflammation of lymph nodes. Lymphadenitis means inflammation of lymph nodes. Inflammation of lymph nodes. In acute adenolymphangitis, we can also see other features like lymphedema, lymphedema, and mainly in this lower limbs are involved. Lower limbs are mainly involved, and Lymph nodes are axillary, femoral, and inguinal lymph nodes are involved. Inguinal lymph nodes are involved. Lymph nodes are involved. And these lymph nodes are tender, they get swelled up, and pain will be there. Then we move on to the chronic filariasis. In chronic filariasis occurs after 10 to occurs 10 to 15 years after infection. And in this there will be an immune response against dead worms. And because of this immune response there will be because of this immune response there will be because of this immune response there will be fibrosis of lymph vessels. Fibrosis of lymph vessels. Because of this there will be obstruction of because of this there will be obstruction of lymph vessels will be there. This leads to lymph edema. And we can also see hydrocele. Hydrocele means a clear fluid will get accumulated in the cavity of tunica vaginalis of scrotum. And chyluria will be there. Chyluria means milky white substance. Milky white substance is excreted in the urine. Milky white substance excreted along with the urine. And we can also see elephantiasis. As name suggests, there will be a swelling in the both limbs. It looks like elephant legs, elephantia. And we can also see elephantiasis. As name suggests, we can see legs of the infected person will be having elephant-like legs. I mean, both legs will get swelled up, and uh, swelled up means lymphedema will be there. And in edema, there are four grades. In edema, there are four grades. Grade 1 is non-pitting edema. Sorry, Grade 1 is pitting edema. Grade 1 is pitting edema, and it is reversible. It is reversible on limb elevation. On limb elevation, and grade 2 is non-pitting edema, and it is irreversible even on limb elevation. Grade 3 is also non-pitting, but uh, we can see a fibrosis of the lymph vessels. Fibrosis of lymph vessels will be there. In grade 4, we see a scarring in the on skin. Scarring in the skin. Then we move on. In tropical pulmonary eosinophilia, there will be hypersensitivity reaction against filarial and I mean micros microfilarial antigens and um, this microfilaria, when microfilarial larval stage migrates to the lungs, where they get lodged and destroyed. When they get lodged in the lungs, there will be a sensitive reaction against microfilaria antigen. Because of hypersensitivity reaction, there will be increased eosinophils in the blood. Increased eosinophils. Increased eosinophils will be there. Name suggests eosinophilia means increased eosinophils in the blood because of hypersensitive reaction against microfilaria antigen. And but in this we can't see microfilaria in the blood. We cannot see microfilaria. Microfilaria will be absent in blood because they already got migrated to the lungs. And then we move to the immune complex mediated. When immune complexes containing microfilarial antigens, they may get lodged in the various organs like kidneys and joints. In kidneys, they cause hematuria, proteinuria, and they may also cause nephrotic syndrome. As we already know, proteinuria will be seen in nephrotic syndrome. And in joints, when these immune complexes containing antigens, I mean macrophilaria antigens, get lodged in the joints, they cause filarial arthritis. Filarial arthritis. It means there will be inflammation of joints because of the these immune complexes containing microfilaria antigens